There is a quiet assumption that slips into daily life without much resistance. If something is sold as a vitamin, it must be safe. And if it is safe, taking more of it should only help. That assumption becomes less true with age. I'm Dr. Warren Hung, and on this channel, I focus on helping you understand how your body changes over time so you can avoid problems that often go unnoticed until they are harder to manage. If you find these explanations helpful, consider subscribing. This channel is built to give you clear, practical insight you can actually use. Now, here is where this becomes more important after 60. Your body is not handling nutrients the same way it did 20 or 30 years ago. The systems that process vitamins, your kidneys, your liver, your blood vessels are still working, but they are working with less reserve. They are less forgiving. And that means something that once passed through your system easily can now linger, build up, or interact in ways you do not feel right away. This is one of the reasons I see confusion in clinic. A person is trying to do something good for their health. They add a supplement, maybe 2, maybe 3. They feel responsible, they feel proactive. But under the surface, something else is happening. Some vitamins are stored in the body. They do not simply leave once your body has what it needs. They accumulate. And when they accumulate, they can begin to affect organs that are already more sensitive with age. Other vitamins change how medications behave. They can make a drug stronger than intended, or weaker. And that shift is often invisible at first. You might still feel fine. And that is part of the problem. Feeling fine is one of the most common forms of false reassurance I see. Especially after 60, many of the processes that lead to heart problems, kidney strain, or circulation issues do not cause immediate symptoms. They build quietly. So when someone tells me, I've been taking this for years and I feel okay, I pay close attention, because the body does not always signal stress in a way that is easy to recognize. Another change that matters here is absorption. As we age, the digestive system becomes less efficient at absorbing certain nutrients. That leads many people to increase their intake, thinking they are compensating. But absorption is only one side of the equation. Processing and clearance matter just as much. If your kidneys are filtering more slowly, which is common after 60, then certain compounds stay in your bloodstream longer. If your liver is processing more slowly, breakdown takes longer. The result is a higher internal exposure, even if the dose looks normal on the label. This is where the misunderstanding begins to matter. A standard dose is designed for a general adult population. It does not account for reduced kidney function, multiple medications, or changes in body composition that happen over time. So, the same capsule can behave very differently in a 70-year-old compared to a 30-year-old. And there is another layer that often gets missed. Some vitamins affect calcium balance, blood thickness, nerve signaling, or blood pressure regulation. These are not small systems. These are central control systems in the body. When they are pushed too far in one direction, the effects can show up as subtle increases in blood pressure, irregular heart rhythms, kidney stress, changes in how blood vessels respond, or even increased risk of events like stroke over time. Not because vitamins are inherently harmful, but because the context has changed, and the body you have now responds differently than it used to. This is why I want you to think about vitamins in a more precise way. Not as good or bad, but as active substances that interact with your biology. Some are helpful when used correctly. Some become risky when taken without considering age, dose, and interaction. And some are simply misunderstood. There is also a pattern I want you to notice. Many of the people who run into problems are not neglecting their health. They are trying to improve it. They are adding supplements on top of an already complex routine prescriptions, over-the-counter medications, diet changes. Each addition feels small, but together, they create a system that becomes harder to predict. And when something shifts, a new medication, a slight decline in kidney function, a change in diet, the balance changes. That is when issues begin to appear. Often quietly. Sometimes only visible through lab changes. Sometimes only after a complication has already developed. So the goal here is not to avoid vitamins entirely. The goal is to understand which ones require caution, especially after 60, and which ones can still support your health when used appropriately. Because there are vitamins that can help maintain nerve function, support bone health, and assist with energy metabolism in ways that become more important with age. But there are also vitamins that can interfere with medications, disrupt internal balance, or place unnecessary strain on organs that are already working harder. And the difference between those two groups is not always obvious from the label. That is exactly what we are going to clarify. We are going to look at the ones that are most commonly misunderstood, the ones that seem harmless but can create problems in the wrong context. And we are also going to look at the ones that, when used correctly, can actually support the systems that tend to weaken over time. Because once you see how these nutrients behave inside the body, the decisions become clearer. And more importantly, safer. But before we get into the specific vitamins, you need to understand why your body handles them differently now than it used to. The difference is not just about age as a number, it is about how your internal systems are managing load. After 60, several quiet changes begin to overlap. Each one on its own may seem small. Together, they change how your body responds to something as simple as a daily vitamin. Let's start with the kidneys. Your kidneys act as filters. They remove waste and help regulate fluid, electrolytes, and certain nutrients. Over time, kidney filtration naturally slows. This is well documented in large population studies, such as the National Health and Nutrition Examination Survey, where gradual declines in kidney function appear even in people without diagnosed kidney disease. This matters because many vitamins, especially water-soluble ones, are cleared through the kidneys. When filtration slows, those substances stay in circulation longer. That means the same dose leads to higher exposure inside your body. You do not feel this directly. There is no immediate signal. But over time, this can contribute to imbalances, especially when supplements are taken daily without adjustment. Now consider the liver. The liver processes nutrients, medications, and toxins. It modifies them so the body can use or eliminate them. With age, liver blood flow and enzyme activity can change. Not dramatically in most people, but enough to alter how substances are broken down. This becomes more important when vitamins interact with medications. Some vitamins can influence the same pathways your medications rely on. They may speed up or slow down how a drug is processed. In some cases, they can change how strongly a medication works. This is one of the reasons medication lists should always include supplements. But in practice, many people do not mention them because they do not think of vitamins as active substances. They are. And your body treats them that way. Another shift happens in body composition. As we age, muscle mass tends to decrease, and fat distribution changes. This affects how certain vitamins are stored. Fat-soluble vitamins, in particular, can accumulate in body tissues over time. They are not flushed out quickly. They build. And when they build beyond what your body needs, they can begin to affect organs such as the liver, blood vessels, and even the nervous system. Again, this does not usually cause an immediate symptom. It develops slowly. Now let's look at absorption. It is true that absorption of certain nutrients can decrease with age. For example, vitamin B12 absorption can become less efficient due to changes in stomach acid and intrinsic factor. This is well described in clinical guidance, such as the National Institute on Aging. But here is where the misunderstanding often happens. People hear that absorption is lower, and they respond by increasing intake across the board. The problem is that not all vitamins are affected equally. Some may need attention, others do not. And increasing everything without distinction can create imbalance. There is also the issue of medications. After 60, many people take at least one prescription medication, often more than one. Blood pressure medications, cholesterol-lowering drugs, blood thinners, diabetes medications. Each of these interacts with the body in specific ways. Now add supplements. Even if each individual item seems harmless, the combination can create interactions. Let me give you a simple example through something I see often. A patient in his early 70s once told me he was trying to support his heart health. He was taking a multivitamin, an additional vitamin supplement he had read about, and his prescribed medication for blood pressure. He felt responsible, he felt proactive. But over time, his lab values began to shift slightly. Nothing dramatic at first, just small changes. His blood pressure became less stable. His kidney markers moved in a direction that suggested increasing strain. When we reviewed everything he was taking, the issue was not a single substance, it was the combination. Some of the supplements were influencing how his medication behaved. Others were adding to the workload his kidneys had to handle. And this illustrates something important about how the body works. When multiple inputs affect the same system, their effects are not simply added together, they can amplify each other. What looks like a small change can become a larger physiological shift. That pattern points to a larger issue. After 60, the margin for error becomes smaller. The body still adapts, but it does so with less flexibility. Systems that once compensated easily now require more careful balance. This is especially true for systems that regulate blood pressure, electrolyte balance, fluid distribution, and vascular tone. Vitamins can influence all of these. And that is why context matters. Another point that deserves attention is timing. Some vitamins, when taken at the wrong time, relative to medications, can change absorption. For example, Certain minerals can bind to medications in the digestive tract and reduce how much is absorbed. This is not obvious unless someone specifically looks for it. But the result can be that a medication appears less effective, even though the dose has not changed. This can lead to dose adjustments that are not actually necessary because the underlying issue is interaction, not disease progression. There is also a psychological layer. Taking vitamins often feels like a positive action. It creates a sense of control, and that is valuable. But it can also lead to assumptions. If I am taking this, I must be protecting myself. That is not always true. Protection depends on the right substance, the right dose, the right timing, and the right context. Without those, the effect can shift from helpful to neutral, or from neutral to harmful. So when we talk about vitamins after 60, the real question is not simply what to take. It is how each one interacts with your current physiology. Which ones your body can handle easily, which ones require caution, and which ones, in certain situations, create more risk than benefit. That is where clarity becomes important. Because once you understand how these systems behave, the list of good and bad becomes much more specific and much more useful. And this is exactly where we need to look closely at the vitamins that are most often taken with good intentions, but can create problems when the context is not right. Now that you understand how your body handles these substances differently, we can look directly at the vitamins that require the most caution after 60. These are not bad in every situation, but they are often taken without context, and that is where problems begin. Let's go through them clearly. Number 1, vitamin A. Vitamin A is often associated with vision and immune support. That part is true. Your body does need it. But vitamin A is fat-soluble. That means it is stored in your body, mainly in the liver. It is not quickly cleared. When intake exceeds what your body needs over time, it accumulates. And after 60, that accumulation matters more. The liver is already processing medications, nutrients, and toxins with less reserve. Adding excess vitamin A increases that load. Over time, high levels can lead to liver stress, bone thinning, and even increased fracture risk. This connection between excess vitamin A and bone health has been observed in long-term studies, including analyses from Harvard School of Public Health. What makes this tricky is that vitamin A is already present in many multivitamins and fortified foods. So, people often take more than they realize. This becomes a problem of accumulation, not intention. Number 2, vitamin E. Vitamin E is often promoted for heart health and as an antioxidant. But in higher doses, especially from supplements, vitamin E can affect blood clotting. It can make blood less likely to clot. Now, for someone not on medication, that might not create immediate issues. But after 60, many people are taking medications that already affect clotting, blood thinners, antiplatelet drugs. Adding high-dose vitamin E on top of that can increase the risk of bleeding. Sometimes subtly, sometimes more significantly. Large trials, including those referenced in guidelines from the American Heart Association, have not shown consistent cardiovascular benefit from high-dose vitamin E supplementation, and in some cases have raised concerns about harm at higher doses. This is a good example of something that sounds protective, but can shift in the wrong direction when layered onto existing treatment. Number 3, vitamin B6 in high doses. Vitamin B6 is essential for nerve function and metabolism. But in supplement form, doses can vary widely. At higher levels, especially over long periods, vitamin B6 can actually damage nerves instead of supporting them. This is called peripheral neuropathy. People may begin to feel tingling, numbness, or burning sensations in the hands and feet. And here is the confusing part. Those symptoms are often mistaken for age-related nerve problems or even diabetes-related changes. So the cause is missed. Regulatory bodies, such as the European Food Safety Authority, have set upper intake limits because of this risk. Again, the issue is not the vitamin itself. It is the dose. Number 4, vitamin K in the wrong context. Vitamin K plays an important role in blood clotting and bone health. In the right context, it can be beneficial. But if you are taking certain blood-thinning medications, especially warfarin-type anticoagulants, vitamin K intake must remain consistent. Sudden increases from supplements can interfere with how those medications work. This can reduce their effectiveness. And that raises the risk of clot formation, which can lead to serious events such as stroke. The National Institute for Health and Care Excellence specifically emphasizes the importance of stable vitamin K intake for patients on these medications. The issue here is not that vitamin K is harmful. It is that variability creates instability. And instability in clotting balance is something the body does not handle well. Now, If you look at these four together, a pattern begins to appear. Each one serves a real function, is often taken with good intentions, but becomes risky when dose, storage, or interaction is not considered. And most importantly, the effects are not always immediate. They develop quietly. That is what makes them easy to overlook. You might not connect a supplement you started months ago with a change that appears gradually over time, but your body is connecting those dots. So when you evaluate what you are taking, it is not enough to ask, is this vitamin good? The better question is, how does this behave in my body, at my age, with my current medications and health conditions? That shift in thinking is what prevents problems. Because the goal is not to remove support. It is to remove unnecessary risk. And once that risk is reduced, the next step becomes much clearer. Because there are also vitamins that, when used correctly, can support the systems that tend to weaken with age, and those are worth understanding just as carefully. Now that we've clarified what can create problems, we can shift to what actually supports your body after 60. These are not quick fixes. They are not guarantees. But when used correctly, they align with how your body changes over time. They support systems that naturally become less efficient, and they do it in a way that is generally well tolerated when properly managed. Let's go through them clearly. Number 1, vitamin D. Vitamin D plays a central role in calcium balance, bone strength, immune function, and even muscle performance. After 60, your skin produces less vitamin D from sunlight. At the same time, your kidneys are less efficient at converting it into its active form. That combination makes deficiency more common. Low vitamin D levels have been associated with increased fall risk, weaker bones, and reduced muscle strength. This has been observed in multiple trials, including work referenced in guidelines from the Endocrine Society. But here is where precision matters. More is not always better. Vitamin D should ideally be guided by blood levels. Too little is a problem, but excessive supplementation can raise calcium levels in the blood, which may stress the kidneys and affect the heart. So the goal is not maximum intake. It is the right level. Number 2, vitamin B12. Vitamin B12 supports nerve function, red blood cell production, and cognitive health. After 60, absorption becomes less efficient due to reduced stomach acid and changes in intrinsic factor. This is well described in clinical guidance from the National Institute on Aging. The result is that even with a normal diet, levels can gradually decline. Low B12 can lead to fatigue, memory changes, and nerve symptoms such as numbness or tingling. And because these symptoms can overlap with normal aging, the deficiency is often missed. Supplementation, when needed, can help maintain levels and support nerve health. But again, context matters. Not everyone needs high doses. The right approach depends on lab values and individual absorption. Number 3, magnesium. Magnesium is involved in hundreds of processes in the body. It helps regulate muscle function, nerve signaling, blood pressure, and heart rhythm. After 60, intake is often lower than recommended, and certain medications can reduce magnesium levels further. Low magnesium has been associated with higher blood pressure, irregular heart rhythms, and increased vascular stiffness. Large observational datasets, including findings from National Health and Nutrition Examination Survey, suggest that many older adults do not meet optimal intake levels. But magnesium is not one size fits all. Different forms are absorbed differently. Some can affect digestion, and in people with reduced kidney function, excessive intake can lead to accumulation. So while magnesium can be helpful, it should be chosen and dosed carefully. Number 4, vitamin K2, in the right context. Earlier, we discussed vitamin K as something that requires caution in certain situations. Here, we are focusing on a specific form, vitamin K2. Vitamin K2 plays a role in directing calcium to the bones and away from blood vessels. This matters because, with age, calcium handling becomes less efficient. Instead of staying in bone, calcium can begin to deposit in arteries. That contributes to vascular stiffness. Vitamin K2 works with vitamin D in a coordinated way. Vitamin D helps absorb calcium. Vitamin K2 helps place it correctly. Some research, including observational data from cohorts such as the Rotterdam study, has suggested a relationship between higher K2 intake and better cardiovascular outcomes. But this comes with an important condition. If you are on anticoagulant medications, especially those that depend on vitamin K balance, supplementation must be discussed with your doctor. So again, the theme remains the same. Helpful in the right context. Risky in the wrong one. Now, if you take these 4 together, they form a pattern. They support bone strength, nerve function, muscle stability, vascular health. These are systems that tend to weaken gradually over time. and supporting them early helps maintain function longer. But I want to bring this into something practical. Because knowing the list is one thing. Using it safely is another. A simple way to think about this is as a daily framework. First, do not stack supplements automatically. Start with what your body actually needs. That usually means checking blood levels when appropriate, reviewing medications, identifying gaps rather than guessing. Second, keep doses within reasonable ranges. Avoid the mindset that higher is better. Your goal is balance, not overload. Third, keep timing and interaction in mind. If you take medications, ask whether a supplement changes absorption or effect. Even a small interaction can matter over time. Fourth, reassess periodically. Your body changes. What made sense at 60 may not be the same at 70. And finally, pay attention to signals. Not just how you feel, but what your labs show, what your blood pressure is doing, how your energy and sleep are changing. These are early indicators. They tell you whether your current approach is working with your body or against it. If there is one thing I want you to take from this, it is this. Vitamins are not automatically protective. They are tools. And like any tool, they can help or harm depending on how they are used. If you have been taking supplements without reviewing them recently, this is a good time to pause and take a closer look. Not out of concern, but out of clarity. If something in this discussion sounded familiar or made you reconsider a habit, let me know in the comments. It helps guide what I explain next. And if you want more clear, medically grounded explanations like this, consider subscribing so you can continue learning how to protect your health as your body changes. Your body is still adaptable, but it benefits from precision now more than ever. And the more you understand how it responds, the better your decisions become.